Okay guys, I'm going to take just 15 minutes and make it a short part because we have a club on this. Okay. So this is just some applications in medicine. In disease detection and diagnosis, this IBM seems to be a huge leader in that technology. So in newborn babies, now they have introduced a software in our newborn in US. It's called Innocence BB. It's it can predict sepsis in neonates. So you just keep the values on the EMR automatically getting into that. Then you tell you this baby is likely to go into sepsis. So you can say disease detection diagnosis even before that. A smart, very good doctor also pick up these things, but the system will trigger before anybody else may think about it. Personalized medicine is the new one. So if you just think about this, now we are doing preclinical, making a new drug. First in human is phase 1, safety is phase 2, randomized control study phase 3, and then post-deployment evaluation is phase 4. But personalized medicine is like for each patient based on your genomics, your physical exam, environment, socio-economic status, you try to make a diagnosis for each one. Each one may be slightly different from somebody. Like you take your talk, like maybe the ovarian cancer may be slightly different than our economic genetics may be slightly different. Then intervention point assessment, molecular studies, you can use all these kind of diagnostic techniques. The drug for me may be slightly different from Vignesh based on our genetics, even though we are from Tamil Nadu, from South India, but our genetics may be slightly different, so we make use a slightly different gene. Then testing to see whether the drug works, we may use slightly different tests for him or for me to see because we may respond differently, we may have different things. And finally sharing these results onto a platform so that other people can learn from our genomic medicine. So this is the future of sort of genomic medicine, or not genomic, AI medicine for personalized medicine may actually be really useful. Then the next one is AI imaging. Now this is a publication in the journal called Bioengineering. So the number of AI used, previously I have shown you that in every specialty they are using radiology. And the number of publications are going up. So 2023 there were 24 original publications for AI in medical imaging. And a lot of systematic reviews. So if you want to know which is the maximum organ being used, it seems that lung is the, even in India now people use it for TB, for cancer. Next is heart, then breast, liver, then for histology and for eye. So we are also going to start using for eye in medicine very shortly. Clinical trials, they say that, suppose we want to identify, let us say one of us wants to PhD, which wants to do a clinical trial of HIV patients. Instead of searching all the HIV patient database, if you just tell the AI if I identify all the HIV patients, it will reduce your workload by 70%. Instead of you going and searching charts and doing here and there, it quickly pick up. So it can help you to quickly pick up patients. Drug development, I'll talk about in a little while. Informed patient care. So when you are taking the history and physical, it will start telling you, like I told you last time, I think you should take this extra history. You will be forgotten this particular examination. Then, when you are saying that, okay, for Charles I am going to give this enalapril, it may pick up as if Charles is allergic to luminescent inhibitor, or Charles also has microalbuminuria, so therefore let us, why not we give some other drug. So it's going to help you with the treatment. And procedures also. What procedure we do for Charles particularly. And this all is happening instantaneously. You are taking history, physical, it is transcribing for you and putting it into history, physical. It's also giving you a summary note, the summary of history and physical. When you are going to order the test, it's telling you these are the possible tests which you could order, these are the particular treatments which may be useful. Now, when we online we do EMR, it will give an alert. If you prescribe 2 drugs which are interaction, it will give you a But that depends on the software which is from UK, and we have to keep it updated every year. That I think it's on British Medical Formulary they are taking that. But this will be a real time, and for your previous side effects, your drug interactions, it can reduce medication error even more. Cost of care. So if you can reduce medication error, it's a big cost in many hospitals. We don't capture how much medication error causes. You know, like what we had long ago, we had an example. HIV patient, we get AZT. What is AZT? Old HIV drug. You know, the consultants have heard of AZT? Azithromycin. That was the first HIV drug. So we wrote AZT in our prescription, and the pharmacist got azathioprine. So the HIV patient, instead of getting a HIV drug, got azathioprine, which is immunosuppressant. Luckily, after 3 months, the patient came back, somebody saw, oops, we didn't say anything, but it was a terrible error. So those kind of errors could have fatal costs and consequences. So virtual assistant. So let us say that one of our medicine 2 patients tomorrow morning, the day after OPD has allowed. They can call one of us on a phone number in our time and energy going back to the workstation. If they have virtual chat box and say, I'm a patient of medicine 2, this is what happened. Some of them, the chat box may be able to tell you how to deal with some of it. I think last time I showed you the example. Fraud prevention, some people are trying to game the system, it will pick up less of fraud going on. More administrative tasks, a lot of the administrative tasks can be done by an AI. Why should we do appointments, fixing here, there? And then like I have got OPD appointment today, but my CT is tomorrow. You can just flip it around, okay, they change the appointment to the next day or do something. Those are things which one human being need not be sitting and doing it. AI can do that for you. So patients immediately after going to the OPD, they think I should have asked so many questions I forgot to ask. So they get stressed out. So now that AI chatbot can be useful after hours. Then if the patient asks, the AI chatbot is asked 100 questions. Thinking like, okay, these are the dangerous symptoms which the patient has. So the next day the doctor doesn't have to answer 100 emails. Okay, there are 5 patients with important symptoms which are red flag. Those you tackle. All the rest of it, the AI will manage. So it's alert to the additional attention needed. These people, you may need to do something else. So then, it will say that I'm taking medical history. And I know that patient is currently on 4 drugs. Then let's say there was a 5th drug patient was on earlier, patient was stopped. Oh, patient's hypertension is not controlled. Let me add amlodipine. Then it will alert you. Amlodipine was stopped earlier because of weak edema. So it can help you with those kind of things to be. So it will also tell you, okay, this amlodipine goes to past history, whereas tell me certain is current history. You can put it into that. So traditional clinical research, this is the government of India's Drug Controller General of India, now is called Central Drug Standard Control Organization or CDSCO. So all new drugs for any new condition, the CDSO will then do randomized control study or cohort study. And then they say it has to be acceptable, so much benefit should be shown and cost effectiveness has to be shown. And this is well established by Government of India. However, if it's an AI algorithm, who's regulating the AI should be used or should not be used? So that's an important thing. But we want the same level. If I'm using AI to diagnose TB in X-ray, I want to be very sure they're not picking up cancer and saying TB or some old fibrotic scar and saying active TB. So I want to make sure that AI is also doing very well. So we want the same level. So we need some standards for testing AI and use in medicine. But those standards are not very clear. So that's what important thing. Everybody says AI. But what are those standards? We must be clear about. So in research, what are those AI standards? Now I just like to make a joke. So now everybody is talking about, Elon Musk is talking about sending man on the moon. So India also has now Mangalyaan and everything. So very good. Like this is the last week I told you R.K. Lakshman's common man. So he says that this is our man, he can survive without water, food, light, air and shelter. It's a common man's status. So he said, I volunteer to go to Mars because there's no air, water and stuff. So what is the story I'm trying to say? So first of all, you must ask the correct question. And we should not land up with those like that. Okay, we can take that for the plan. So the AI can influence the behavior of healthcare professionals. Suppose we say that the AI is reading the test X-ray. Do you think that sometimes in a busy OPD you won't look at the X-ray yourself? You just look at the AI generated report. After some time you stop learning how to read X-ray because only the AI is reading the X-ray. It makes mistakes you will never know. So it can positively influence your behavior as saving time. The hope is that instead of looking at the report, you spend more time talking to the patient. But we may decide to finish OPD quickly also. They can be quickly understand. I also may make this. The idea is that it make you give more time to the patient, but you may change your behavior in good or bad ways. It may lead to an improvement of outcome of care. So we must have, suppose AI is done this clinical test. Did it make the patient's life better or worse? Somebody should study that question, ask the question. Okay, what is the impact of having introduced that? Now the thing is, the intervention as X-ray AI is defined. Scalable means it should not say that can be used only in medicine unit of CMC. It should be across the whole of CMC, in all different campuses of CMC, in rural, urban and tertiary care. It should be scalable and applicable, easy to be applied. It should not require one big, huge, massive computer in every one of these centers. So the problem at hand, it should not be influenced by factors outside the domain of the problem. Let us say AI depends on internet, and internet is not freely available everywhere. Fantastic system works great, but most places have no internet source system. So if we be careful of all these questions, we will try a new AI intervention. So the outcomes must work the similar outcomes should be there in every clinical situation. It should work as well as rural, urban, in primary care, secondary care, tertiary care. The last one, across different prevalences. So suppose TB is very rare in some part of India, the AI should work as well as in a place, let us say, where, like for Shakti's example just now. That was in a place where people are referred for ovarian cancer. So in a gynae OPD, the prevalence of ovarian cancer must be much higher than in general medicine or in PHC. But in all three settings, the AI should work as well. So then is there a public health benefit? So if we introduce AI in India, will there be a public health? So many governments, I think Bihar, Rajasthan, are having AI for test X-ray, right? Because there's no one to do test X-rays. It takes 3 months for the X-ray to be reported. So even if not greater sensitivity specificity, at least some report is better than no. So they seem to think it has got a public health benefit. So the AI, pure AI, which was we learned about from Bangalore, it was staying in South India, but will it work as well in people in North? The prevalence of TB may be different. There may be other lung diseases which may confuse with TB there, which may be different from what is will confuse it in South India. So we must be aware of this before we deploy that. And remember that India doesn't have enough money, and AI is not cheap. People think AI is cheap because we have Google, and then you can put Meta on your WhatsApp, you can search. It's not free. This kind of AI is very costly. And one more thing which people don't realize, for the AI to be maintained, you need large amount of electricity. So that in fact, Elon Musk, of course, for some reason I have a fetish for that fellow. He said that to support the AI he is doing, he has to put a nuclear power plant to have electricity for all the AI that US needs. So that's what I'm saying. So the hidden things in AI which people don't realize. And purposely making everybody aware that AI has got a huge cost which people don't see. So let's see some of these things. Does anybody know what generative AI is? Generative means something which is not there, it is generating new. Evidence which is not there, it is generating evidence newly. That's called generative AI. It can create images, it can create videos, it can create music and 3D models without human effort. So you just say something, give me this, and the generative model will create that. So that's called generative models. It's a type of machine learning model. If you're interested, I'll explain each of these. One is called generative adversarial networks, or GANs. where they use neural network. And remember once I gave the example in an artificial neural, like a neuron it uses. Then the second one is called variational auto encoders, VAE. So you can take an image, the computer will make it into something and then recreate it as an image. So it's learning from whatever you give, it will recreate it in the latent space and then recreate the image back for itself. Auto-regressive models. So there the computer from the data you give, it will make something. From what it has made, it will make something new. From that, it will make something new. So it's like a process. It will from one to one to one it will learn. That's just called auto-regressive model. The last one is called transformers, which is the chat GPT. You say something, it will give you a large output. That's called a transformers. So these are the, just out of interest for people to know that there are 4 types of generative AI. One is adversarial networks or GANs. The second one is variational auto encoders. Then the third is auto-regressive model. And the fourth one is transformers. Increasingly all our publications will be full of this. Just to aware that there is something like this called generative AI. So let's learn some areas where it's used. Art. Now you can see that this is the original painting. We just told the AI, recreate this painting in space. So you can see that now it looks a little bit more like a new age thing. This is, if you go to this website, deepai.org.art, you can do this yourself. You upload a picture and then say what the transformation you want, it will do it by itself. Only thing is all the software, you can even do music. You can put one music, let us say put a old Carnatic music and then say I want to do modern song, that will change it. But they charge you money. The first time it will be free, so then after that you have to just be aware if you try that. But it's a nice thing. So this is art and music. Second one is text generation. So now ChatGPT 3 is working, now ChatGPT 4 has come about. So let me see if somebody can do this challenge. How many of you know story of Cinderella? There was a princess who was not allowed to go for a ball and then finally she magic fairy sent her there. The challenge is you have to make one sentence. Each sentence has to begin with the next alphabet of the letter. The first sentence word should be A, then B, then C. Sounds like a dumb thing to do. Anyway, it's obviously a dumb thing to do. That's not me. So this is actually ChatGPT. A beautiful Cinderella, A, B, C, dwelling eagerly, finally gains happiness, inspiring jealous king. Love magically nurtures, opulent prince, quietly rescues leper, triumphs, uniting many wondrously. Of course, it sounds really dumb. But I'm saying, this is just done by ChatGPT. It doesn't understand anything, but it's able to make a sentence. You just get this sentence. You are typing this in. It understands what you want and it's creating something. So this is the example of text generation. And this is the website. You can do this yourself. OpenAI.com, and you can do ChatGPT 4, and you can make it create like thesis. This is my thesis, like TV, Mendel's and steroids. Give me a literature review, like of so many words, so many pictures, so much this. It will create something, but you have to read and see whether it may land up sounding like beautiful Cinderella, really very. So you should be careful of the output of ChatGPT. This is the next one, deepfake. You all heard about deepfake, you all are tech savvy guys. So this is, if you go to ChatGPT, can you make deepfake images? Last time I told you, it has got ethical code. It will realize that, hey, this is unethical, we won't do this.